So thank you very much for bringing me over. I think I brought some slides with me, yeah. All the way from Norway to inviting me. You know, Norwegian, we've always felt welcome here in the UK. We felt like a partnership. You helped us a lot during World War II, but this goes back a lot more than that, you know, further back. I'm not sure you always invited us, but we came across anyway. And I bring this picture because I think Norwegian actually brought the first mental cases here to the UK. These guys were feeding on poisonous mushrooms and bad ale, and I truly think that you got your first cases right there. Okay, so back to the agenda. Dignio is a company. We've been in the telehealth and remote patient monitoring space for more than 5 years now. We focused much on the chronic conditions, the diabetes, the hypertension, COPD, etc. And we work very closely with the city of Oslo so that we don't only develop the technology as said, but we've had equal emphasis on the methodology, how, you know, the patient pathways, how to do this, and how to implement it. So we actually have some roots here in the UK. We were able to piggyback sort of on the whole system demonstrator project that was run here some years back. And we were able to learn a lot from that. And we built on that, and we extended the methodology a lot since that, included some preventive medicine principles. We highly believe that it's a holistic perspective of the patient that will bring us forward. We also think that activity-based treatment and nutrition is important, so non-medication-based treatment is important for our group. And I'll just share some of the experience that we brought from Norway in this sense. What we see typically among our patients, and these are patients though with chronic diseases, but they very often have mental issues as well. We were complicated human beings. So what we see is the first round, you know, of being on this solution, just to be practical, is we try to get to know the person that we treat. So we not only do the vital signs, but we also ask questions about, you know, their personal life, their habits, their family, and all of this. And that's the first step. The second step is when we get to know them, try to give them advice that could be helpful for their situation. And this is where we see that patients start to get some knowledge about their own situation. This is very different from reading a brochure about, you know, diabetes or something. This is more applied to themselves. So they feel more knowledgeable about it, and they become more self-managing. After a couple of months, we see even more behavioral changes. We see that they get more active. Maybe they start eating more correctly, you know, adhering to our advices, and they see the effects on their body, so they get motivated to continue doing this. So the system as such is composed of an open software-based system. It has a part for the patient, it has a part for the clinician, and everything is cloud-based. And the app is really designed to be very easy to use also for people that have no digital experience before. We have patients in their, well up into their 90s. And we had one lady, she said, you know, I have one of those, what are they called again? Yeah, mobile phones, yeah. I've received a text on it. I've never sent one. And she's using this today, every day. So we equip them with tablets today because this age group, they want to have larger, you know, displays. They get their own journal, so everything that the clinician is writing here is coming up for the patient in real time. They do some daily measurements where this is applicable. This is a thermometer that I just used. Everything is wireless that we use. And it connects automatically and it uploads automatically. And nothing of the information that is sensitive is stored on any of these devices. It's everything in the cloud. So it's very secure in that manner. And then on the clinician side, we've just designed it together with the nurses and doctors so that it should be easy to manage a lot of patients in an effective way. All the things that are not normal will appear at the top and be prioritized, and then some more administrative things will follow on the dashboard lower down. So it's kind of enabled you to take care of many people. We see the picture of 150 to 200 patients for one nurse, and then a doctor is usually applied to a group of 4 nurses or something. So we use the nurses as the primary contact for patients. One more thing that the customers that came to us required. We can't involve the IT department, they told us. So we just need something that can work out without that. I encourage them to involve the IT department, but it's not required. So the other area that we also focus on is medication adherence. And I show this because it's not our invention. It's actually a UK product. You can buy it, and many knows it. But we buy the one that has the connection, the SIM card. So it works, for the individual, that they get a notification when the medication is due, and they just flip it on top, take the medication. This is registered here. In our case, if the patient does not take the medication, it is reported to our platform, and it can be then notified to the family or to a carer or whoever. We can, implement as many as you want. And then you can call the person and just check up if everything is okay. If they take the medication, nothing more will happen. If they still don't take the medication, the window when they should take it closes, and the medication is no longer available, and there's another notification being sent to the system. So in this way, the local authorities in Norway have found that this is a really good way to follow up that patients are really taking the medication, and this is very important also for the patient group that we're talking about here. And it's totally manageable from this platform, so you can adjust the dosage or when the dosage should be given, etc. So that's what we do. And I just brought this slide because I want to say we have great respect of how to implement new technology into health organizations. It's really a challenge, and we know that some of the clinicians are really resistant to it. We believe that some of this is done because we don't invest enough in training. They don't feel safe about this, and if they're not safe about it, they don't want to introduce it to patients. So we emphasize that every time we do an implementation, you have to do enough training, and the people need to feel comfortable about it before they can introduce it to their patients. So that's at least one of the learning that we've taken. But now we're working with the City of Oslo since 2013, January 2013. So we actually gained a lot of experience in, what are the bumps that you have to overcome, and what we should avoid, what we want to do. We know that it's very demanding for management to pull this through. You really have to be strong. Pulling a change like this through is what we've observed. And also we kind of found fans in this disruptive but not disrupting. It is disruptive because we are delivering healthcare in a new way. This is distant it's remote healthcare. People are sitting in one place and they're helping a lot of people in their own homes. So they don't have to take the travel. So it's disrupting in that meaning. But at the same time, in our methodology, we emphasize the relationship between the carer, the clinician, and the patient. And we believe this is kind of not disrupting because we think this is at the core of delivering healthcare, to have real people involved in giving healthcare. The results are quite amazing. These results come out of the cohort of, the most common chronic diseases. And there's a lot of anxiety among, for example, COPD patients. So just getting better so they don't need to get to hospital, they don't need these doctor's consultations. One number's not on the board is 51% less use of emergency and acute care. So these are some of the best numbers we've ever seen, and we think that the combination of emphasizing methodology and technology is key to doing this. Just a few examples, because there are people with mental health issues among this population that is treated. Depression is a lot widespread among the senior population. We see the clinicians getting on video, or they could also visit them to set up some goals. In our system, then, they enter these goals, and this is something that is then being monitored, and the patient is replying to how they perform this every day. So they typically answer in the evening. How did their morning routine go? Did they get to work in time? All of this, regular meals. Exercise is, we had a funny story. A guy, he told us that because he had diabetes, he was very dependent on being more active, and we asked him how this was working for him, and he said, you know what, I sit down in the evening, I'm answering the questions. One of the questions is, have you been 25 minutes active today? And it says, I know the person that's going to read this answer. I can't lie to her either, right? So then I have to go to, I have to go the trip 25 minutes, and then I can answer yes. It helped him a lot. It really drove him, this relationship. And then we see therapists also engaging with the patients through this messaging platform, which is encrypted, so it's very safe to do with the patients. And then they come back and they review the goals after a period. Just brought another example. My background is not medical, so these are from our doctor that we have, in our team. A patient with schizophrenia needed to change medication, and we monitor this both through, checking whether she was taking her medication at the right time, and also then by checking for symptoms and effectiveness through questions and answers that they did on the platform, and successfully got through this critical phase. Just wanted to alert you to a new extension of this platform that we're doing now. We believe sleep and sleep quality is very important for this patient group. And we just come across a sensor that could monitor sleep and non-invasive. So we will be able to, over the next couple of months, to implement this into the platform. So someone you would like to monitor in this way, we could read out all of these parameters after the night. When you go to bed, how much time you spend in REM sleep, if you go out of bed during night. All this quality of sleep kind of things is possible to get out of this sensor and the software that comes with it. And this is something that we're implementing as we speak. So this is what we have experienced from Norway, from mostly working with City of Oslo, but we have a number of other cities that we also work with there. Not specifically, targeting a cohort of mental illness, but we see that they are part of the population. It's a complex picture, and we see that it helps also with this patient group. Thank you very much for listening. Thank you.